Hello and welcome to RXNT. My name is Hector and I'll be your trainer for today. Today, we're going to be focusing on the electronic health records product. We always start by going to our website, www.rxnt.com. Friendly reminder to be using the approved browsers, which are Chrome, Firefox, and the latest version of Microsoft Edge. Also, if you're using a tablet, make sure that it is at least 13.5 inches, otherwise your visibility might be compromised. When you go to rxnt.com, this is our main webpage. In the upper right corner, we have client login, so this is for yourself, and any additional staff users will be logging into the system. And right next to that, we have patient login for any patients using the patient portal. Today, I am going to log in as a staff user. And when we first log in, this is what we call the main product dashboard. We call it the product dashboard because you can see all 4 products. On the top, we have the electronic health records and the e-prescribing. Both buttons will take you to the same place. On the bottom right, we have the billing, and on the bottom left, we have the scheduling. Before we go into the electronic health records, I do want to point out this upper utilities gear. Each product has a utilities gear in the upper right corner. The menu is different depending on where you are and also based on your level of authority. If you are set up as the practice administrator, you will have full access to this utilities gear where you can update password, create profiles, or manage staff users, upload company logo, add providers, company preferences, intake for management, PNP connectivity, and if you are a provider set up with EPCS to send out controlled substances, you will also have an option on this menu to manage your token. When we log into the electronic health records, this is what we call the provider's dashboard. On the top, you can search for existing patients by first name or last name. Next, you have a little funnel that will give you additional search fields, such as phone number, date of birth, account number. Next, you have an orange button that says Add Patient. This is how you can add a new patient that is not in RXNT. We always recommend that you search before you add to avoid having duplicates. Next, we have another utilities gear. Inside of the EHR, we have some clinical admin tools, some group level favorites, medication management, patient forms, short keys, and other tools all the way at the bottom. Now, when I do electronic health records training, I do like to cover the short keys, especially for any providers. If you ever find yourself typing the same thing over and over again on your encounter notes, the short keys are a great way for you to save some time. To create a key, we're going to go to the upper right corner to add a short key. Now for the key, you need to use a symbol. The purpose for the name is to identify the text inside of the key in case you're using the same symbol for multiple ones. Towards the right, we have some advanced options, some placeholders that will automatically enter the provider's name, patient's name, gender, age, service date. You can change the font and the format if you need to. After you save, the little floppy disk turns into a pencil to edit and a little trash can to delete. Now in this section is where you can create your short keys. When I get to the encounter for today, I will show you how to use it. Next, we have the main menu in blue. This is what we call the provider's navigation menu, and this menu is here to help you keep track of all of your patients. From the right to the left, under More, if you are signed up for eFax, your first option will be fax. We are going to be talking about that eFax when we get to the patient's chart. Messages that the patient sends to you via the patient portal, and we actually talk about that messaging system in the patient portal training. If you refer patients out, you can see your most recent referrals, patient's name, referred to, referred date, and the status. Under reports, you can generate different types of reports. An example of this could be today's appointment report. On the left, you can search by dates. Towards the right, you have additional filters. Columns will make things visible or invisible on your report. So as you can see, when I deselect, I am hiding. When I select, I am including. Filters will allow you to filter or search by specific things, such as provider's name, location, patient's name, appointment type, so on and so forth. With the red icon and green icon, you can download and print as a PDF. The same with the CSV file, which is the equivalent to an Excel sheet. Under documents, you can review any documents coming back from the patient. So basically any intake forms, consent forms, or documents that the patient uploads and sends to you, they are first going to stop right here for you to review and accept. After you accept those documents, they will automatically transfer into the patient's chart, and I will show you where those documents are going to be stored. Under labs, only if you are connected with an interface, you can review any lab results coming in. Under prescriptions, the same thing. This is not where you write a prescription, but this tab, it's here to help you keep track of all of them for all of your patients. Here you can see your most recent, up to 75. Any prescriptions that have been entered in the system and saved as pending, where the provider can review, approve, or void, and any pharmacy request. All of those are going to be displayed right here on the bottom. You do have the ability of filtering the results on the bottom by patient's first name or last name. Under encounters, the same thing. This is not where you write an encounter, but this tab is here to help you keep track of all of them to make sure that all are signed and that all are released to billing. Right now, we don't have anything showing up, but once we are done with our encounter for today, I will come back to the provider's dashboard and I will show you how that looks. And that takes us to today's appointments. Here you can see any appointments that you have for today, not for tomorrow or yesterday, just for today. Here we have the provider's name, location, patient's name, appointment type, the time and date of the appointment, any material resources that have been linked to this appointment, any notes that were entered on the appointment, and the status of that appointment. Now, only when the appointment is checked in, the system is going to generate this little green plus sign that is a shortcut. When you press on it, it's going to take you into the patient's chart, but very, very specifically inside of that encounter tab where you can start your notes. Now, when you click on that little green plus sign, it doesn't only start the encounter for you, but as you can see on the bottom, it's also linked to the visit. Now, we're going to come back to the encounter section a little bit later during the training. You can still access the patient's chart from today's appointments by selecting the patient's name or searching for the patient on the top. This will take you into the patient's chart. It is just not taking you inside of the encounter tab. Now that we are in the patient's chart, this is what we call the patient's dashboard. And this is actually where you are going to be working with your patient. This is where you're going to be documenting information, writing prescriptions, and creating encounters. On the top left corner, we have a little avatar. Next to it, a pencil. If you want to take or upload a picture of your patient, now required for ID purposes only. On the bottom of the avatar, we have the patient's name as a hyperlink, as well as towards the upper right corner next to the avatar. When you click on it, it's going to take you into the patient's demographics, where you can update their phone number, email, address, gender, and you can also add a favorite pharmacy to your patient's profile. The patients also have their own navigation menu. The navigation menu is customizable per user by using this utilities gear. Towards the right, you have two little arrows pointing up and down that will allow you to change the order of your navigation menu based on your workflow or just simply your preference. Anything selected on the left will be part of your navigation menu. If it's not selected, we are just hiding it from the navigation menu. The small avatar will collapse the big avatar on the top, and the three little lines will collapse the entire navigation menu, giving you a bigger workspace. From the bottom up, we have notes. These are not encounter notes. These are notes for yourself, for your staff. If you need to remember something specific about this patient, this note section is for internal use, so you can use it for whatever you want. To enter a note, go to the plus sign, type the note, and save. The system is going to generate a little post-it note, letting you know that you have a note there in case you want to review. Here you can see the time and date that the note was entered, who entered the note, and the note itself. Towards the right, you have a little folder to edit and a delete button. Now, please note that anybody in the office can enter, view, or edit the note, but only the provider will have the delete button. Under patient documents, a couple of things are going to happen in this section. For one, all of those documents coming back from the patient, this is where those documents are going to be stored after you review and accept. You also have the ability of going to the top plus sign and manually upload a document to the patient's chart, the same way that you upload a document to an email. The document itself and the type of document are required fields. Title, description, and document date are optional. Now, on the bottom of patient documents, this is another section inside of the EHR where you are going to have access to your eFax. If you want to compose a fax, you go to the plus sign and select who you're sending this to. Your address book will open up as a dropdown. Towards the right, you have a plus sign to add the contact information. After you add the contact information, you are going to start to create your own address book. So you have an address book icon right next to that if you need to edit. The attention to will be the equivalent to a subject line on an email. Optional, you can include a cover sheet by selecting this little box. And on the bottom, you can choose a file and send it out. Now, if I go ahead and close this window out and I jump very quickly to the navigation menu to fax email, you are going to notice that it's exactly the same thing. So you can send a fax from inside the patient's chart, from fax email, as well as other areas that I am going to be pointing out today, or from inside of patient documents. Now, if we actually think about this, all patient documents are going to be stored inside of patient documents. That is the reason this eFax inside of patient documents has additional folders. Any faxes that you send from the patient's chart are going to be stored in the sent folder. Any faxes coming into the practice, they are first going to stop in the provider's dashboard inside of faxes. When a fax comes into the practice, it is not assigned to the office or to a patient. If you assign that fax to the patient, that fax will transfer over and it will be stored inside of the receive folder. And right next to that, you have one extra folder for any faxes that you wish to archive. If you need to refer your patient out, you can do so by going to the upper right corner to the plus sign. Use the plus sign in the middle of the screen to add the contact information. Anything that has a red asterisk is a required field. Make sure that the fax number is correct. Those referrals will be going out by fax. Once you save and add them to the system, you are going to start to create your own address book. So if in the future you need to refer your patient again, use the magnifying glass, hit search, and any saved providers will be listed right here on the bottom. Problems is the same as diagnosis. To enter a diagnosis, go to the plus sign. This is a free text area, so you can type anything that you want, including searching by ICD codes. So if you have a patient that has a pain on the left arm, you can type pain on the left arm. If you are cardiology, you can type anything related to cardiology, mental health, general medicine, so on and so forth. Now today, let's say that our patient suffers from hypertension. When you add a diagnosis, the system will include this green triangle, just letting you know that you need to save, and after you save, it goes away. Next, you have a globe, and this globe will give you patient education in both Spanish and English that you can print out and give to the patient. In the middle, you have your ICD codes as well as your status. Towards the right, we have two little arrows, folder to edit. And this is also how you can change the status. Delete button all the way to the right. Under labs, we have two tabs on the top, results and orders. Now, on the results, if you are connected with an interface, any electronic results coming in will be displayed right here on the bottom. You also have the ability of going to the upper right corner to the plus sign and manually document results in. Also, if you go to the bottom, you have another plus sign where once more, you can attach a result to the patient's chart. If you need to place a new order, go to the Orders tab, add the type of test, select your diagnosis. Now, something to note about this diagnosis section, this is not a free text area. When you click on it, it opens up as a dropdown. So for you to have a diagnosis to select from, you first have to enter that under the Problems tab. Select your urgency. The green plus sign will add test to the order. The red one will remove test from the order. Next, if you are connected with an interface, you will be able to send this out electronically. If you're not, you can go ahead and save. The lab order will come up with the patient's information on the top, the order in the middle, and your information on the bottom left. From here, you can print this out and give it to the patient. Under medications, we have different tabs on the top: current, previous, history, voided, pending, pharmacy request, and scheduled prescriptions. Now, in RXNT, this schedule tab is not for controlled substances. This is if you write a prescription and you schedule that prescription to go out in the future. If you need to document a current medication without sending a prescription out, you can select this plus sign, start typing. Now, as you can see, I didn't have to type the full thing. I just typed a couple of characters and a dropdown will open up for me to select the specific medication and save. If your patient tells you that he or she is almost out, that they need a refill, you can select the current medication on the left, press the refill button, select your dosage, search for your pharmacy, send the prescription out. If you need to write a brand new prescription, type the medication's name, enter or search, select your dosage, search for your pharmacy, send the prescription out. Any prescriptions that you send through RXNT are going to be documented in the previous folder. So if I actually go ahead and send this Tylenol to the pharmacy, Tylenol will be in my previous folder. But then in my current folder, I am going to have both the Adderall that I manually entered in and also the Tylenol that I just sent out. The history will display up to a year of the patient's most recent prescriptions, including prescriptions sent outside of RXNT, any voided, any pending, and any pharmacy request. And of course, e-prescribing is covered in detail in the e-prescribing video. If you need to document your patient's vitals, you can do so by going to the upper right corner to the plus sign. Notice no red asterisk, so you can do as much or as little as you want. You have height and weight on the top. BMI will automatically be calculated. Blood pressure on the bottom. Temperature in the middle. Once you are done with your information, you can go ahead and save. If you need to see your patient's progress in a chart, you can select from this drop-down, hit show, and you can see your patient's progress in a chart. PFSH, that stands for Past, Family, and Social History. You have those three tabs on the top. Under past history, you have your medical history, surgical history, hospitalizations, implantable devices, allergies, and medication history all the way at the bottom. For any of them, select the plus sign, start typing, select from the drop-down, enter any reactions, any comments, and save. Now, if you select the allergy on the left, or in the case of medications on the left, and add it to current medications, or in this case, to current allergies, what this is going to do is that it's going to push that information over to other parts of the system. So in the case of medications, it's going to update your current medication list. In the case of allergies, you can see that the bee pollen is already there. You don't have to enter that information again. Next, we have family history. So let's say that your patient tells you that they have a family member that suffers from depression. We can search for our depression, select the family member, the living status, and save. Edit and delete all the way to the right. Under social history, this is where you can select your smoking status. So let's say that your patient never smoked, you have other tobacco products, alcohol consumption, female patients, and additional social history fields. Notice no red asterisks, so you can do as much or as little as you want. Now, in the patient portal, the patients have a blue menu like this one, and towards the right, the patient has more. Inside of more, they have their history with the same three tabs that you have on your side of the system: past, family, and social history. They do have the ability of entering that information for you the same way that you do on your side by selecting the plus sign. If they do, this external source data button to the right is going to be moving around, letting you know that the patient entered information. If you click on it, you can review the external data, external meaning coming from outside. So this on the top will be the information entered by the patient. And on the bottom, you have your active data, the information that you have on your side of the system. You can select the external data on the left, add it to active. If you accept those changes, that information will automatically transfer to your side of the system. And we do also go over this in detail in the patient portal training. Under allergies, you can use the plus sign to document any additional allergies that your patient has. Now, it is important that you do because when you prescribe, the system runs an interaction check based on allergies, current medications, and diagnosis. You will get an interaction alert. And that takes us to the encounter. The encounter is where you are going to be documenting your patient's visit. Some of the work has already been done for you because the encounter talks to the other tabs on the navigation menu. So that means that your problems, medications, vitals, history, allergies, immunizations, all of that information that is entered in the navigation menu before you start the encounter will be pushed into the encounter. To start the encounter, we're going to go to the upper right corner to add encounter, and this window it's going to come up. This is the same window that comes up when you click on the little green plus sign under today's appointments. But now that I started the encounter manually, you can see that it's not a link to the visit. And we're going to get to that in just a moment. To start the encounter, select the form that you want to use. Now, as you can see, I don't have any forms to select from, and the reason is this dropdown will only display my favorite forms. So I haven't selected any forms as favorites. To search for the forms, we're going to go to the upper right corner to manage forms. Anything under favorites will be part of your dropdown. If you decide to do custom forms, you will have a fourth tab between favorite and suggested holding your custom forms, some suggested, and all. All will give you the entire RXNT library of encounter forms that are available for you to use for your patient's visits. As you can see, we have hundreds and hundreds and hundreds of forms. Now, in the middle, you can filter the results on the bottom based on specialty, description, or keyword. So if you are general medicine, you can type general. If you are cardiology, you can search for those forms as well, mental health, chiropractic, so on and so forth. Now I'm going to show you how to use the filter in the middle. I'm going to search for a couple of forms so that way you can see how the filter works. And then I'm going to preview a couple of forms for you. So again, if you need to search for general, we can type general. Some providers like to use SOAP notes, so you can type the word SOAP. If you do telemedicine, we can type telemedicine. For my mental health providers, if you guys do any type of PHQs or GADs, we also have a couple of them in the system. Chiropractic, Botox, so on and so forth. Now the encounter forms go from very, very simple like this one. This is one of the simplest forms that I've been able to find in the system. So as you can see, this form has no tabs on the top. This form is basically one empty piece of paper. Again, just one empty piece of paper, doesn't have any vitals, no medications, no problems, so on and so forth. So the encounter forms, they go from very simple like this one to very lengthy like this one. Now this one, different from the other one, this is one of the lengthiest forms that I've been able to find in the system. This is a very complete form that is mostly used for general medicine or family medicine. This one does have HPI, chief complaint, vitals, medications, problems, so on and so forth. And as you can see, different from the other one, this one has different tabs on the top. Now again, with the black icon, you can preview the form before you add it to your favorites. Once you find the form, you can select the form on the left. You can do more than one if you need to, and add to selected forms. This will add it to your favorites, and remember, anything under favorites will be part of your drop-down. Now select the encounter form, the node type, and go. Your encounter workflow is going to look a little bit different depending on a couple of things. Number one, your settings and your encounter settings are located on the utilities, intake workflow options. And number two, the encounter form that you select. Now, just to give you an example of what this means, if you select an encounter form that has vitals, for example, which I know that some providers do not document vitals, then reviewing vitals will be part of your workflow or your encounter. If you select an encounter form that doesn't have vitals, then reviewing vitals will not be part of your workflow or our encounter. Now, in the middle, you can still change the date if you need to. A lot of clients ask me, how do I backdate an encounter? You can simply change the date. You can also adjust the node type. You can manually link this encounter to the visit, which again will automatically happen if you start the encounter by selecting the little green plus sign under today's appointments. Now, only when the encounter is linked to the visit, you are going to have an additional icon towards the right to enter your checked out notes. On the scheduler side, when you click on the appointment, on the top of the appointment, you have different tabs. The first one is the appointment information, the second one is payments, and the third one is checkout. This is where those checkout notes come from. The provider will have a little pen to sign the encounter. Some users, depending on the level of authority, will be able to release an encounter to billing and floppy disk to save. Underneath that, we have this collapse all sections. I personally like this a lot. I feel that it makes it a lot easier to navigate, and you can just open the fields that you want to work with. Now, as you can see, some of those fields have the word update towards the right. The ones that have the update, those are the ones that talk to the navigation menu on the left side. Again, allergies with allergies. If I open this up, you can see that our bee pollen is coming over from the allergies tab. You still have a plus sign to add more inside of the encounter. And if you do, that new information will flow back and update the navigation menu only after the encounter is signed. The same thing with the current medications. If I open this up, we can see that our Adderall is coming over from the medications tab. You still have a plus sign if you need to add more. Delete all the way to the right. Next, we have our past family and social history. The same thing, that information will pull over from past family and social history. Now from here, we can just open the fields that you want to work with. Now keep in mind that all the encounter forms are different, so all the fields inside of that encounter form are going to be different depending on the form that you select. Some sections are going to be areas where you can mark, select, type comments. Some forms, such as this one, will have the little body where you can mark, type. You can also draw. If I have any providers that do like Botox, this will be like a little face. If I do, of course, mental health, then we probably won't have this little body. You can still change the gender if you need to. And other areas are going to be completely free text areas where you can freely type information. Now, a lot of the free text areas, such as this one, this is also where you can use the short key. If you remember at the beginning of the training, we created a short key using the Alt symbol. Just type the symbol, press Enter, the symbol disappears and the entire text will come out. Here we have the text that I typed. This is the placeholder for the provider's name, and this the placeholder for the patient's name, RXNT test. Now, on the top, we have different tabs. Both the number and description of the tabs is going to be different depending on the encounter form that you select. Some encounter forms, such as the very simple SOAP note with no coding, or the doctor's note that I show you, will only have the 1 or 2 tabs. Others have 3. This one has 4. The next one is the clinical. The clinical will just give you additional exam fields. On the bottom, you have your assessment, follow-up comments, health concerns, referrals, studies, goals, immunizations, orders, assessment and plan, and the physical exam all the way on the top. The next one is the coding. Here you have your place of service, and you also have your diagnosis and your procedure code section. So we have under our diagnosis, coming over from the problems tab, same thing, you still have a plus sign if you need to add more inside of the encounter, little trash can to delete, and also under the 3 little dots. And right here on the bottom, this is where you can enter your CPT code. Select your diagnosis. If you have more than one diagnosis that should go with that CPT code, you have a plus sign towards the right and save. Next, we can preview the form. The form it's going to generate in the PDF version. It's going to have, if you have a logo uploaded to your account, the encounter form will have the logo on the top left corner, your information, the patient information, and any information that you entered on the form. Now from preview, this field will open up to the right where you can create and save your own macros, not required. A macro, it's basically saving your content inside of that encounter form and making that content available for you to use with future patients. And we are going to be talking about macro in the next couple of minutes. Enter your checkout notes, sign the encounter, release to billing. With this little X in the middle of the screen, we can properly close the encounter out and it will be saved as a draft. Towards the right, we have 3 little dots where you can edit, view as a PDF, duplicate previous encounters, continue and edit where you left off. To duplicate an encounter, all you need to do is press duplicate, release to billing, sign, print, fax it out. This is another section in the EHR where you have access to your eFax. And if you do it from here, it will automatically attach that encounter and you can fax it out. Download and delete. Now, please note that once you sign the encounter, it's going to be a legal binding document. The delete option will disappear and you're also not going to be able to do any changes. If you realize that you do, you can go back in and on the top right corner, you are going to have an orange button that says amend encounter. The status will still say signed with the little red dot in this corner right here, letting you know that that signed encounter has an amendment. It is important that you let your billing department know to ensure that they do the proper billing. Now from here, I'm going to take a very quick pause and I am going to return back to the provider's dashboard. Now that I have an encounter that has not been signed or released to billing, you can see that I have a little number telling me how many. Under unsigned, I have the patient's name. The status could be drafted or reviewed. You will get a review status if you are using an encounter form that requires a dual signature and only one person has signed. And towards the right, you have this folder. If you press on it, it will open the encounter and you can continue working with it. On release, will display any encounters that have not been released to billing. Here we have the patient's name. The status in this case could be drafted, signed, or reviewed. And towards the right, you have this little green arrow pointing out. If you press on it, you will be releasing this encounter to billing. If you need to go back into the patient's chart, select the patient's name, and this will take you back into the patient's chart. Now, macros. To use the macro, you start the encounter like you normally do. Go to the upper right corner to add encounter. The first thing that I am going to mention about macros is that macros are only available under the encounter form where I created the macro on. So what that means is that if I select this custom encounter form, you can see that my macro is not available for that one because the macro was created under this one. Now a macro, again, for the most part, is content for the most part. So you are basically adding this content into this empty encounter form. Now, macros are not patient specific. So even though I created this macro under RXNT test, this macro is available for me to use with all of my patients. Now, if we pretend that we are creating an encounter for Jennifer and using our macro, Jennifer's encounter will have Jennifer's vitals, Jennifer's medications, Jennifer's allergies, Jennifer's diagnosis, Jennifer's past family and social history, Jennifer's name, date of birth, so on and so forth. But as you can see, we added our content into our empty encounter form. Now, on the top right corner, on the utilities all the way to the bottom, we have other tools, and here we have manage macros. Macros you can create under a real or fake patient, or you can come to utilities, other tools, manage macros. If you select add template, this will basically open up the empty encounter form for you to enter your content and create your macro. Exactly the same thing, any macros that you have created only available under that form. So as you can see, nothing under this one. If I select the other one, there's my macro. If I click on top of the name, it will open my macro up and it will allow me to manage the content. So let's say that the content that we have inside of this macro, it's old information. We are not using that information anymore. Now we have new information that we want to include in our macro. You can create macros for new patient, patient follow-up, medication management, a specific health condition. If you select the macro on the left, you can delete the macro. So you can always feel free to play with the test macro. You can always come back to utilities, other tools, manage macros, and you can delete it if you were just planning or playing with it, or you can edit if you're planning on keeping it. Next, we have chart summary. Towards the right, you have a send button to send to the printer, download, and also fax it out. So this is another section where you have access to your eFax. And exactly the same thing, if you do it from here, it will attach that chart summary and you can fax it out. Appointments will display the patient's history of appointments, including future appointments and past appointments, time and date, the provider, the type of appointment, the status, and the notes that were entered on that appointment. If you need to record your patient's immunizations, you can do so by going to the upper right corner to the plus sign. Anything that has a red asterisk is a required field. Once you are done with your information, you can go ahead and save. Towards the right, you have the sidebar, and on the top right corner of the sidebar, you are going to have this orange chat icon to chat with your staff. All the way on the bottom, we have this orange question mark. If it has a little black dot, that means that we had an update in the system. So we're going to keep you updated at all times. On the bottom, you can share your ideas with our development team, request additional training, and inside of the Help Center, this is very, very helpful. This is where we get a lot of our information from. Let's say that you're trying to send out a controlled substance and having issues with your token. You can type the word token, and here we have how to get a new token, how to use the token, how to activate the token, for newer providers, how to complete ID proofing for EPCS. If you can't find the answer to your question, you can chat support, and the chat is available during business hours. That basically concludes the EHR training.